to say that it makes me and my colleagues more determined than ever to press forward and do all we can to write, as the Premier said, the last chapter of this book to be a better chapter. He said history will judge the previous chapters, history and analysis will judge the previous chapters, but we cannot buy back time. What we can is use the time ahead in a wise, strong, determined, together, collaborative, focused, and serious way. And on that note, there are immediate asks that we have. Number one, we have been asking for the last 3 or 4 weeks that every person that goes into a nursing home must wear a surgical mask. What that means in real terms is that every personal support worker, every nurse, every housekeeper that gets close to a patient, every volunteer, if there are still volunteers that go on into nursing homes, they must wear a surgical mask, and they must receive 2 of those masks when they come into work. Absolutely, they must. And this has nothing to do with the limitations of President Trump, to which I will speak later on, but have everything to do with our own production here, because these are very simple to produce. The code is very simple. So this is my first ask to my Premier and my Minister: fast forward. We have been asking fast forward, full speed, to start production today, to work 24/7. So in a couple of days, every single home, every single nursing home has the necessary surgical masks. These are simple and cheap, to give to every single person walking into that door of that nursing home, because that will help us shape a bit, not flatten, but shape a bit the top of the curve of this outbreak situation that we find ourselves in. There are, as far as I know, and I have the list, 55 nursing homes already in outbreak in Ontario. We can't afford to continue with the policy that is, we bring the masks after the outbreak. We absolutely need to bring those masks now, so that we don't have the significant spread of outbreaks that we are seeing in the province. And that is a must. So that those families that have been deprived from seeing their family members that are in a nursing home, rightfully so, because we want to protect the residents, but so that those families have a chance to see their loved ones when this terrible situation and crisis is over. Let's make sure, Premier, Minister, that this is the first priority, and that the medical officer of health, Dr. Williams, mandate them as others have done in Toronto, for example. Second, people living in shelters, people living in homelessness in our streets. I spoke with the minister, I wrote a letter to the minister. The minister needs to trigger the legislation necessary, so the places, 4 of them, that are ready to launch sites to take care of homeless people that are COVID positive, are up and running now. We cannot wait that there is an outbreak, a serious outbreak in one of the shelters, which will go up like fire, because the crowded conditions that homeless people live in shelters. Another time is the time to talk on what we should do in the go forward to prevent people living in those crowded conditions that are inhumane. But right now, what we need is trigger the legislation so we can open those places, and so inner city can get moving with their plan, which is second to none in the world. We have 100 registered nurses that will work under the leadership of Dr. Lee Chapman, on a nursing model to care with dignity and with care and with expertise for homeless persons and that are COVID positive, and that must happen now. So Minister triggered that legislation today. Third, to my colleagues that work in home care, those colleagues now are not being allowed to come in to the patients' homes, people that have cancer that need treatments, people that have wounds that need to be cared for. Those nurses that work in home care need the supplies. And we are talking again, surgical masks that is nothing and impossible to produce. Then the nurses that are toileting in and out, working tremendously heroically in hospitals, and that will have the toughest of times in days and weeks ahead. To you, my colleagues, and to the doctors that work in ICU, and you that work in ICU with ventilated patients, COVID positive, we know that you must have the protection that you need in order to protect yourself from contracting the virus so that you can keep healthy to take care of those patients, and so that you can go home and be with your family and have your life back when this nightmare is over. Colleagues, to nurses, doctors, respiratory therapists, everybody that works in those ICUs and in any other unit that has been preparing to free up ICU beds for you. Please know there are 6,000 RNs waiting to be deployed to you via nurse, powered by RNAO, with no charge, not a penny, as a service to the community and to Ontario, is ready to deploy those 6,000 nurses, 6,000 RNs, of which 700 are critical care nurses specialized in ICU with the competencies up to date. 140 are nurse practitioners ready to come to work with you. Do not wait till next week or the following week when the crunch will come and when the chaos will set in if you don't have the surge capacity that is essential for you to not stretch to breaking point your own colleagues working today. Now is the time to act. Now is the time in the next coming 2-3 days to get those resources on board to your organizations so that when the crunch and when the more and more patients will walk through your hospital doors, that you are ready to work in a way that you can sustain it. Colleagues, we are here for you. We are here with you in the good days and in the days that will be less good and more difficult ahead. Please know you can always count in RNAO, and so does the public. So let's all bring together an all-in approach. The public staying home now, staying home, not only physical distance, but staying home to protect yourself, your families, our health professionals, and our health system. To the government, by starting production of the surgical mask in mass. RNAO asked a week ago, actually 10 days ago, for 9 million surgical masks a week. This is what we need. 9 million surgical masks a week to be produced. And those can be produced in Ontario. You need to produce also quickly the N95, the goggles, the face shields, the aprons, all that we need so we protect our healthcare professionals, and our organizations have the means to protect them. I know we can do it. So I'm confident and I am optimistic that if we are an all-in approach, we are going to get through this and we are going to come out of this dark tunnel having a better chapter than otherwise it would be. Thank you very much. I will open to questions, PG.
And there's cheese. I heard the cheese. But I'm like, I heard chickadees, and then right outside of my head.
I have a question. I can go ahead.
Please do.
Okay. So hi, it's Emma McIntosh from National Observer. I'm just wondering, that today the province, that the chart they showed us kind of made it seem like if they can't get more ICU capacity on in the next couple of days, we could see the need exceed the capacity. I'm wondering if you think that based on what's going on right now, the government will be able to open up enough spaces.
So opening more ICU beds requires a few things, especially it requires the space, and I see no problem on the space. You can move more and more patients, and hospitals have already done that. They have moved patients to different units, so you can then dedicate a whole new unit to become ICU. They do require also ventilators, and that's where likely, unless we can bring from other places or produce, we will likely be short, and ventilators are essential to save lives. So that's what the province is trying very heavily to do, and that's where many efforts of many new manufacturers or retool manufacturers are going. The third thing, and you don't hear enough, and I didn't hear at all today about that government and also others that spoke are forgetting, is that those beds in ICUs and those beds with even ventilators need nurses, need registered nurses that have a specialty in ICU. And this is where we are saying we have 700 of those nurses in reserve. No one has taken them either. No one has taken one of those. 700 nurses ready to serve the public. The time to move those nurses with the expertise that is current to date, registered with the College of Nurses, et cetera, et cetera, et cetera, the time to move them to the workplaces is now, not next week. And then we will not be in the situation that Italy found themselves. They found themselves that they didn't have at the end of the day the nurses, not the spaces and the ventilators, but actually the nurses to attend to patients. We predicted, RNAO predicted all along, because we saw it because we are connected with many other countries, so we learn from them. We learn from China what they did. I am in touch with my colleagues in Italy daily, in Spain. The major fallout in Italy was not having enough nurses and doctors. Here we are saying, we have the nurses, 700, take them now so you can give them an orientation, not about ICU because they have the expertise in ICU, but the orientation to your hospital. And of course you need also the doctors, the ICU specialists, intensivists that specialize, and the Ontario Medical Association is creating, and I'm confident that they will respond as well. The issue is, I need to see employers proactively taking those nurses so they're not in a crunch later on. I hope that answered the question.
That was perfect. Thank you.
Very good.
Hi, it's Janella Massa again from City News. I have a follow-up question from your earlier, and you repeated it again today about exactly what you were just talking about, the 700 nurses. Have you talked to the province at all about why they haven't deployed? Have they said what it is that they're waiting for? What's the threshold or what their plan is?
So my fear on that is similar to what happened 6 weeks ago when I said, let's get going. And people thought we were low risk. And because I was so in touch with other countries, I said, my answer was, no, this is not low risk. We need to be ready for the worst. If we will not use it, fantastic, but it's not low risk. I'm saying the same today. Take the nurses today, don't wait. I think our colleague is muted, PG. Unmute her, please. PG? I think PG muted all of us now.
No, I think Janelle muted herself, so she can unmute.
Oh, okay, sorry, I didn't understand. Okay, did that answer your question?
Sorry, I guess my question was, what has the response been from the province when you offered this proposal? What's their response as to why not?
It's more than a proposal. It's already, we are deploying. If you take Michael Garron Hospital, we already deployed people there. So I need to tell you, when I spoke with 2 officials from the government today, they still were not aware of this, which to me is unacceptable. So I don't want to get into those details. I'm saying directly to employers, it's their responsibility to uptake those resources now, because I don't want you to come 2 weeks from now when hospital will be saying we don't have enough people to serve the ICUs, and you will say, but Dr. Grinspun said they had. So I have been repeating, we have been repeating, this has been in my daily reports that goes to every single person. The minister is aware, the premier is aware, Matt Anderson is aware, everybody is aware that we have 5,500 for general care, meaning RNs, for medical surgical floors, for step-down units, for you name it. And we have also 700 critical care nurses. And in addition, we have 140 nurse practitioners. Those are the nurses that in a nursing home can be medical directors now. Those are the nurses that in an ICU can be tremendously helpful, etc. And we also have 5,000 students who are the ones, in fact, that we are deploying the most at this point. And they are going as PSWs, because once a student finishes the first year, they can actually work as PSWs, year 2, 3, and 4. And at least 100 nursing homes have taken a lot of those students. I also heard that Ontario Health Toronto took 40 of those students for case tracing. The Ottawa Public Health Unit took, not students, the Ottawa Public Health Unit took 60 registered nurses for contact and case tracing. So it needs just to spread, and it needs to be communicated, not just from us, but from the government, so that actually the push is take the resources, create the human resource surge capacity, not only the beds capacity, so that you can respond without breaking down, and without breaking down those colleagues that are working there. Does that help?
Yes, thank you. That's much clearer. So you were saying that this call is not to the government, but to employees. So you're talking about hospitals, healthcare facilities, or call centers, or wherever it is.
Wherever it is, any single sector that you can think about, and government should also communicate that, should say this resource is there, use it.
Thank you so much.
You're very welcome. Anyone else, PG, or we are good?
For now, I think we're good.
Okay, together we can do it, and together we will do it. 7:30 p.m., everybody needs to remember, 7:30 p.m. we're doing the clapping, thanking every single healthcare worker and all essential services for doing what they're doing to keep us all well. And one way of doing it is at 7:30 p.m., pots and pans, clapping, and also by staying at home before and after that. Thank you very much.